Hello, I'm Stephen Mcculley. I'm a consultant reconstructive and aesthetic surgeon, and I'd like to talk to you about thigh lift. This is an operation which obviously involves tightening the upper inner thigh, and that's usually following weight loss. So patients who've lost a lot of weight and end up with a lot of excess skin hanging on the inner thigh. There's two ways of doing it. The first involves taking almost like a melon slice of skin from the inner thigh, and therefore it leaves you with a scar right from the front of the crease within the groin all the way around almost to the bottom crease. Now, when you have really lots of extra skin, you also need to take skin down in a vertical direction, and therefore you'd also end up with a scar almost down the inner leg like the seam of the trousers. Now, whether you need the vertical scar in addition to the horizontal crease scar would be discussed with you depending on the amount of weight loss and excess skin that you've had. Occasionally liposuction is done at the same time, but that's not consistent. Now, although this is a good operation of producing some pleasing tightening of the skin, it's very important you understand there are some limitations to it. It's impossible to completely tighten the thigh, and also if you try and get too greedy and tighten it too much, that can lead to some wound healing problems, which obviously we'd like to try and avoid. So in summary, it's a very good operation for creating improvements to laxity within the thigh. Sometimes it needs a vertical scar if it's very marked, and actually that probably produces more tightening. At the same time, the more scars you have, slightly increased risk of wound healing problems, bleeding, infection that you may develop. So, whether you're going to come to see myself or another reputable surgeon for thigh lift, I wish you well with it.